Dr. Harrison, you've had tremendous positive press about your approach at Intermountain Healthcare. I pulled a few pieces. The New York Times describes you as your approach as something virtually unheard of in healthcare. They're sharply cutting costs rather than passing them on. The Wall Street Journal reported that you have radically lowered cost structures. Talk about how you have turned value-based healthcare into a sustainable business model where so many others have failed.
Well, I also learned don't ever read the blogs next to any newspaper article because they're a little ugly. That's like the wild, wild, unmoderated West. And you know, the kinds of changes we've made, and again, we've made them with the support and guidance of our board, because this is really hard stuff. To be able to take a system that is at the top of its game and to say that it's good but not good enough. And the reason it's not good enough is because our quality is not as uniformly excellent as it should be, and our costs are too high. Just for those of you who don't know, the most common concern that Americans have is what happens if somebody gets sick and I can't afford to pay for it. Mm-hmm. And the average American family cannot afford an unexpected $400 expense. And then think about how much healthcare costs. And it's terrible. And so we actually have taken that very much to heart at Intermountain and said that we will have the highest quality in a quantitative fashion in our communities, highest quality healthcare, the healthiest communities at the lowest per capita cost in the United States. So we've actually set that target model, and we're working like crazy to get there. And in order to get there, we had to go ahead and, to some extent, change our economic performance. And in order to change our economic performance, we needed to take out cost. And then once we started to do much better economically, what we've now done is we're passing the savings along to the people who are paying for them. So I'll give you some very discrete examples. We are very fortunate to be a payer provider. I think that is one of the secret sauces of being able to do this. So we have about almost 1 million people who are members in our health plan. And we are responsible both for covering them, but also for providing all their care. And boy, if you do that, you have to be really careful about what you do and need to make sure that you do exactly what the patient needs. What we've been able to do is do things like, say, if somebody is going to pay their portion for a normal childbirth, we've lopped about 25% off of what we charge them. So we've taken our economic success, we passed it along in that way. We've taken a number of our health plan products and we've said no more than a 2% increase per year we're guaranteeing you for the next 3 years, all in. So imagine as pharmaceuticals are going up at about 15% per year. We've said that what's happened with generic drugs in the United States is an obscenity. Mm-hmm. It's absolutely wrong and criminal what some bad actors in the generic pharma space have done. And along with a number of others, and a colleague from the Mayo Clinic sitting at our table, another system that has joined us to create Civica, a not-for-profit drug company that is going to put a stick in the eye of these bad guys, and we're going to go ahead and make generic drugs more affordable. So we're taking very different approaches, but they're all put the patient at the center. It's not about us.
So how do we navigate a world where rich people get good health care, poor people get bad health care, if any health care at all, Clay?
It's an interdependent problem. And there's a theory from our research here about interdependency. But in an interdependent world, you can't change one thing unless you change everything. And what these guys did was they said, once a year, pay us a year's fee, and whatever happens to you this year, it's on our shoulders. Mm. And if you have a great year and you're healthy and strong, then Intermountain makes tons of money. And if, like I, have a bad year, then they lose money. But by making the system interdependent in this way, Intermountain is motivated, very strongly motivated, to help their patients stay healthy. And if a patient gets sick, they are very strongly motivated to help them get well fast. And that system is just really unique in all but a few pieces of the world. And I just admire them. And I think it's true that disruption is at the core of make things affordable and accessible.